Lauren was in the second patrol vehicle when the blast hit. The force of the explosion injured her back. Later, she began to have vivid nightmares about the incident. Trying to cope and rest, she began to misuse opioids, but her sleep just got worse. Eddie has been having a hard time since seeing his brother suffer a fatal heart attack. He lost interest in things that used to bring him joy, like listening to music and getting outside with friends. In the quiet moments by himself, haunted by feelings of guilt that he couldn't save his brother, he started to drink more and more. It didn't make anything better. The few times he tried to go out, he had a panic attack. Lauren and Eddie are not alone. Traumatic events may cause physical injuries and emotional distress, which can have a ripple effect on a person's life. They can also lead a person to use substances in an attempt to reduce the after effects. In fact, many people with post-traumatic stress disorder also experience a substance use disorder, just like Lauren and Eddie. Post-traumatic stress disorder, or PTSD, can lead to sleep problems, feelings of anxiety, irritation, or guilt, and withdrawing from family and friends. Substance use disorder, or SUD, causes people to have difficulty controlling their use of alcohol or drugs. This can lead to medical problems and conflict at work or home. It can also place people in risky situations. Together, PTSD and SUD can make each condition worse. Using alcohol or drugs can increase PTSD symptoms. For example, your sleep quality may decline, and you may have more intense feelings of numbness or isolation. It's important to know help and hope are available. There are effective treatments for PTSD and SUD, and evidence shows that treating them at the same time works. For PTSD, trauma-focused psychotherapies are the most effective treatment. These include cognitive processing therapy, prolonged exposure, and eye movement desensitization and reprocessing, or EMDR. For SUD, the most effective treatments include relapse prevention and cognitive behavioral therapy. There are also medications that have been shown to work well. You can be in treatment for PTSD and SUD at the same time. Another option is to treat both together. An option with strong results is called COPE, or concurrent treatment of PTSD and substance use disorders using prolonged exposure. Whichever path you choose, treatment can help you better understand how PTSD and SUD interact, address the impact of your trauma, and decrease your use of substances. You can start by talking with a healthcare professional. They can help find the most effective treatment plan for you to address both PTSD and SUD. Remember, feeling better is possible. You can effectively manage your trauma symptoms and substance use to start feeling more like yourself and get back to doing the things you love. Learn more at ptsd.va.gov. This video was brought to you by the Department of Veterans Affairs National Center for PTSD.